had a very large floater that would whipsaw almost in the center of my vision. And it lasted for many months. It was actually 8 months. So I work with computers, and most of my work is on computer. And I do a lot of driving on the weekends, so back and forth to Michigan, and it was actually affecting my driving. It was making me tired. It was also catching my vision that I wasn't watching the vehicles in front of me as I should. It is actually phenomenal because it's gone away. And so I no longer have the tiredness, I no longer have the distraction, and I'm able to focus on my work. And the driving is much easier because sometimes I end up driving at night. And so the bright lights of the other vehicle also would affect that. I actually went to Walmart and went to their optical center, so they dilated my pupil, and they looked in there and they told me what I had. And they said either I would get used to it or a procedure called a vitrectomy. It sounded like there were a number of complications or potential serious effects from that procedure. So that's actually how I started. So then my wife and I, we researched because we're aware of different medical centers here in Chicagoland area and the North Shore. And found a doctor that had been practicing for 30 plus years, and went to him, and he basically told me the same thing that the optometrist had told me at Walmart. Vitrectomy was the only option, and that you would get used to it. And so I took that information, and months went by. It actually never changed for me, and I never did get used to it. And it was really exhausting. There was actually no discomfort, no pain, no pressure, absolutely nothing. The only thing was the sound. You could hear the snapping of the sound. It wasn't that loud, it didn't bother me, but there was no discomfort or anything of that nature. And then after the medication for the dilation subsided, then that was it. There was no pain afterwards, or an hour or a week, or nothing, absolutely nothing. The improvement was immediate. And so everything was back to normal probably by the next day, when all the medication was for the dilation had dissipated. So it was a very quick time.